Peripheral artery disease is usually associated with blockages in the vessels that feed the extremities. We do have patients that complain of symptoms using the arms, but the most common symptoms that patients have that they complain about, that would be symptoms of leg cramps or aching or soreness or muscle aches when they walk, that after a certain distance, they have to stop and rest, and then they get to feeling better and they can walk about the same distance again, and then the symptoms come back. So with that, we use the term angina or angina when we talk about chest pain that comes from the heart or where the heart doesn't get enough blood flow. But if the legs don't get enough blood flow because of narrowing, we call that claudication. And with peripheral artery disease, we can make those diagnoses and help with symptoms with intervention.
Peripheral arterial disease, much like coronary artery disease, same risk factors: diabetes, smoking, high blood pressure, eating the wrong foods your whole life, high cholesterol, that sort of thing. Just as we get cholesterol in the heart arteries, we're at the same risk for getting them in the arteries of our lower extremities. And it's just a term that means the arteries go into the leg, just like coronary artery disease, get diseased. They get blockages, they get stenosis, they get calcified. It's often less diagnosed than heart disease. Folks get used to living with not being able to do what they used to do. I think it's just deconditioning and somewhat. When the cause may be a blocked artery higher up in the leg and something that we could help them with.
There is a strong correlation between peripheral arterial disease and coronary artery disease. It's still the same process or the same pathology, it just affects the different blood vessels. So if you do have blockage in one area, whether it be in the heart or in the legs, you usually see it in the other vessels. Generally speaking, people will respond quicker to seeing their doctors if they have chest pain, because everybody knows that chest pain may be a bad warning sign. However, when it comes to leg discomfort, some people tend to say, well, maybe it's my muscles, maybe I'm getting weak, and they tend to think that it may be something else, and they may delay coming in. Those are the patients that we feel like we could help if they would come in sooner. And even if it's not secondary to peripheral arterial disease, at least we can reassure them, or if they need to be further investigated, we can proceed at that time.